Bipartisan agreement in Congress is rare these days, but both sides of the aisle apparently agree on one thing. It's time to reform the way pharmacy benefit managers, or PBMs, take advantage of the American healthcare system. PBMs were designed to negotiate lower drug prices for patients' insurance companies through rebates paid by drug companies. More often than not, however, they keep those millions for themselves and use their market power to profit off of their patients. Just 3 PBMs control the market, and each is owned by health insurers that own pharmacies. This complete lack of competition allows PBMs to dominate the marketplace and decide what medicines patients have access to and what they pay for them.
While it is true our companies set the list price of the medicine, PBMs are responsible for setting the terms of coverage and access and in cost sharing that patients have, and their preferences do matter. And when companies have attempted to lower their list price, as they did with insulin and hepatitis C medicines, that was not met with cheers, as JC testified, but rather oftentimes exclusions from formularies as a result of doing that.
One lawmaker used Netflix as an analogy to explain it.
Let's say that you wanted to watch Pirates of the Caribbean, and they said, well, wait a minute, that costs $250 million to make. We're going to need you to pay co-insurance on that. So can you fork over $25,000 to help us cover the cost of that production? Wanting to watch Pirates of the Caribbean is different than having cancer. When you have cancer, you don't get to just say, actually, I'd rather not pay that co-insurance.
Hopefully, leaders learn that PBMs harm patients by both raising the prices they pay as well as limiting the kinds of medicines their doctors can prescribe. Congress is now on a path to end these shady practices once and for all. This is Bio.News.